So welcome back. Now, in the ancient world, the leading cause of death was infection. So all the way up until 500 AD, you had the Egyptians who were living to about the mid-20s, the Greeks and the Romans about the mid-30s. And in the Middle Ages, from 500 to 1500 AD, sometimes the life expectancy went down because an infection would come into a village and half the people would die. When you hit the modern era, which is about 1500 AD and beyond, the life expectancy creeps up because of the invention of the microscope, lab tests, and x-rays. So around the beginning of the 1900s, people are living about to the age of 40. But in 1929, when antibiotics are invented and now suddenly infections can be treated, the life expectancy goes up to 70. Now, what is an infection? An infection is a very tiny thing. It's a super small thing called a microbe that can come into the body and cause a problem. And it causes a problem two ways. It directly damages the body, or the body's reaction damages the body. There are about 1 trillion microbes in the world today, and lucky for us humans, less than 2,000 actually cause disease. Since there are many different types of microbes, there are many different ways that infections can be treated, but we will focus on the two most common, which are the viruses and the bacteria. Now, viruses are very small, and as we learned, they can be very sneaky. They will come into the body, they'll take over a cell, take over its machinery, make more copies of itself, and then infect other cells and other parts of the body. And as we already learned, the immune system becomes active and it sends out T cells, T for tough guys, to fight off the virus, and activates the B cells to create a memory for long-term protection. Compare that to a bacteria, which is much bigger, and when it infects the body, the immune system becomes active, sends out the B cells, B for bacteria, that make antibodies to kill it off, and then also to create a memory for protection long term. As far as the diagnosis of infections, because there are just so many out there, the best test, the most reliable test, is actually doing a good history and physical, asking about the patient's symptoms and seeing if it matches up to what you see on their body. And sometimes labs and tests can be done as well. As far as the treatment of infection, viruses, there are some antivirals out now that do help, but because viruses can change so quickly, they can mutate so quickly, they can bypass these treatments. As far as bacteria goes, they also can become resistant. There are antibiotics that can treat them, but they can become resistant to them as well. And also they can bypass the effects of them. And we will talk about this later. So sometimes the best way to treat an infection is to prevent it in the first place. So washing of hands, staying away from sick people, masking up, vaccines, screening blood products, etc. Now, as far as the long-term outlook for infections, today, most patients with an infection are expected to survive. And if you go back even 100 years, most patients with an infection were expected to die. In the words of C. Arthur Clarke, behind every man now alive, there stand 30 ghosts. Until next time.